I think empowering women to know that, we're busy, we are moms, we're daughters, we're wives, we're co-workers, and just knowing that there are other women struggling with the same issues, and that hopefully together we can find ways in your life that will help improve the quality of your life.
My experience with Lakewood was awesome. Everything from the physicians to the nurses, the way that they treated me and my husband made us feel so comfortable, and they had so much patience with me.
The nurses and the doctors and all the staff are just not just professionals, but they have a real personal interest in everyone.
What's really nice about practicing at Lakewood Health System is that I'm able to practice really cutting-edge, high-tech specialty care, and it's in a rural health setting.
We have a huge service area, and really we're probably the only clinic that provides the comprehensive full service in outstate Minnesota. To my knowledge, no one else does.
My close team involves 2 nurse practitioners, a nurse midwife, and another OB/GYN, and we work together every day, and we're really like family. It's not just a team, it really is a family, and it's just a really neat atmosphere of good collaboration.
What brought me to Lakewood was that I could very much individualize my care of my patients, and when they wanted to specialize into special needs of women, they were very supportive in bringing me on board here and then allowing me to add the specialties unique to my practice.
And then we've got family practice doctors here at Lakewood that take complete care of their patients and let us be a part of that too. It's really a neat setting, unlike any place I've ever been, actually.
My goal is to be there for women every step of the way. I'm available for women having breast issues or concerns, and also I'm there when they are diagnosed with breast cancer. I get calls from women quite often who have never had a mammogram or wait many years in between mammograms. They're scared. They don't really know what to expect. And I try to encourage them that although it's not the most comfortable procedure, it's short-lived, and the benefits you can reap from having that done and possibly finding a cancer at a very early stage when it's very treatable far outweigh the little bit of discomfort.
Some of the older women that I see, and they've had long-term problems that they've been ashamed to deal with, and when they finally come to my door and then we can work through those problems together, and then seeing how much better and how they've improved their lives.
We truly care about our patients and each other, and I think that comes through in an everyday aspect of our care. I think our patients can sense that.
They guide you and help you through everything. The nurses here are wonderful. They treat you like you're a queen.
No matter where I am, on what floor or where in the hospital, everyone seems to have the same care. If we're just downstairs in the cafeteria, if we're upstairs getting checked for prenatal visits, I feel important, and that no matter who I could turn to, they are there if I need them.
Lakewood has been supporting different birthing options, which I've been very grateful for. Women are very much in charge of how their delivery goes as long as it's a safe avenue. So whether it's a vaginal birth after a cesarean section or if they want to look into some of the other birthing options, the nurses and all of the staff are very supportive in bringing that to completion for them.
We also focus on providing care in a holistic manner, so we know that it's just not centered just around the pregnancy, that there's other factors that can, of course, change things with care, and we like to have good family-centered care and know that the mind, body, spirit, everything goes together.
Once she came into our life, and even a couple weeks after, it's just like, I can't believe how much love I have for this person that's only been in my life for such a short amount of time.
People wouldn't know how much happens behind the scenes and how much we want them to get pregnant. I have 5 beautiful children thanks to in vitro fertilization, and I look at them every day, and they're truly miracles.
Going through this process, you have a lot of internal emotions about, is there something that's wrong with me? And you carry a lot of guilt. They really, when we needed it, kind of helped pick us up through that process and encouraged us to keep going.
One of the best parts of my job is providing hope for patients. I tell them when they leave, I don't want to waste their time, their energy, their money, or their emotion. And I tell everybody, I want you to leave my office feeling hopeful, not hopeless.
There's never a point that I don't feel important. Everyone makes me feel special.
It's very comforting to know that we can have our doctor deliver
Being able to
our baby.
choose to keep our doctor all the way through delivery, all the way through our checkups. They know us.
As soon as I checked in at Lakewood, I felt like I was the only patient. Everybody was amazing, the nurses, the physicians, even right down to the housekeepers and food service. Everybody was so courteous and they were incredible.
I feel like the independence of our facility and the size of our facility really allow us to give personalized care to patients, where each patient, as they walk through the door, think and feel that they're the only person on my schedule.